02 and happening right now in the East Bay. Hundreds of Sutter healthcare workers are on strike in Antioch.
Yeah, they say they're protesting staffing shortages and unfair labor practices. We have KRON 4's Will Tran on the story for us live this morning. Will, when do they plan on picketing?
They started actually at 5 o'clock sharp. So we will zoom in. We're on the sidewalk here at Sutter Health off of Lone Tree, and we're about as close as they will allow us, but we will zoom in and you can see they are in the front doors right there. But instead of walking in, they will be there around the clock for the next 5 days. Here's what you need to know. If you have an appointment today at Sutter Health, you will be okay because by law, according to the union, they did give a 10-day heads up. So the hospital did bring in replacement workers in the meantime. So you should be okay, but do not be surprised that you will not see your regular nurses because they are here fighting for a contract. They say they are overwhelmed and just understaffed as far as what's going on. So 350 of them, they say, cannot do the job, and they claim that they were understaffed even before COVID-19. With COVID-19 in place now, it makes their job even tougher, which is why they're hoping that Sutter Health gives them more help in terms of mental help and staffing, so they don't have to do the job of 2 or 3 people when they're already doing so much as it is. Now, we got a chance to reach out to Sutter Health. Take a look at your screen. Here's what they have to say about the situation. We stand by our offer, and SEIU should too. They negotiated this contract. We're confident enough to place it on a ballot, and it was recently approved by more than 3,000 employees at 7 other SEIU represented hospitals across our system. Now, I did get a chance to talk to a spokesperson. They claim that no, they did not agree to anything, and that is why he says clearly they are here. They're not happy with the situation. There's no talk on when they will get back to the bargaining table, but again, they have already told their employer that they will be on the picket line for the next 5 days, and as you can see, they're walking back to this location. This is basically the command center for them as well. So we will talk to them throughout the morning and get reaction from both sides, including live interviews from the nurses who are clearly not happy with their work situation. Back to you guys.
Will, do you think this is going to affect patients at all?
No, because they have been through this before. They did tell their employer 10 days out, according to their collective bargaining agreement. If you go on strike, you have to give us a notice. So Sutter Health, they had an ample time to plan for this. They probably brought in enough replacement workers. We'll try to talk to them in the meantime to see if they have adequate staffing to. I mean, that's kind of hard to find 350 workers, but they are doing their very best that they can. I've covered this story before, and my suggestion is just go ahead and call ahead to see if your appointment is still on the books for today. Clearly, they are marching now back towards us.
Yeah, I see that. All right, we'll check back with you in a little bit. Thank you, Will.